Mrs. Riopelle, let's talk about fat blockers. What really are they? Do they work? I mean, basically, sometimes we get the impression that if you take particular pill, vitamin, whatever the heck it might be, a fat blocker basically, that it blocks the fat and now you can go and eat a pig and nothing happens. Is that true?
Well, there are various different types of chemicals on the market. The one I think you're talking about actually causes our intestines not to absorb about 20 to 30% of the fat in a given meal. So you basically take the medicine and then eat your meal, and it will block the fat. However, if you're blocking fat, then you're also going to be blocking essential fatty acids from your diet and not getting the benefits of the fatty acids. So in my opinion, I don't like the fat blockers. I think there's the benefit and the risks are too great.
I can see that. So basically, we're back to in whole life. If you really look at it, there are not too many, maybe none, real shortcuts. At least not shortcuts which kind of. There's no such a thing like not exercise because you eat enough protein powder, so you don't need to exercise and you build your muscles. It's not happening. But you might need the protein powder. Basically, it's a synergy in life, and you've got to do them all. And if you try to cut out things, it's not happening. Just like those, what do you call those girls who are anorexic or whatever that name is for, where they eat it in and throw it right back up so that they don't gain weight. I mean, right? I mean, it's a little bit. It's something like that. Basically, you do need the foods, you do need the fats, and blocking it out blocks out all kinds of other things also. I can definitely see that. In fact, since we're talking about fat, can you shade a little bit of light on, so to say, a little bit the good fat and the bad fats? Because, you see, I grew up in a countryside, and my grandfather was, I think, 90-some, and he was dying milking a cow. So it's in all right good shape. Despite the fact that he smoked, I think he was a functional drunk, you know what I'm saying? And he ate, I mean, in a farm in Austria during those times anyway, probably still, pork and lots of fat, belly. I mean, it was just, we ate fat. We grow up on fat. But for some reason, I feel that fat was more like a natural fat, and what you mentioned in another video, not a processed fat.
Right.
Tell us a little bit about this thing here.
So the fat is actually, it's a myth that fat is bad in our diets. It's gotten a bad rap over the years, but our bodies do need a certain amount of fat, and then you have to look at the type of fat. It needs a little bit of saturated fat, and then the other types of fat, unsaturated and polyunsaturated. It needs more of the polyunsaturated, and then
what is that? You got to explain to us what that is, the polyunsaturated.
So it has to do with the chemical bonds around the fat, and the polyunsaturated is better for our system because it doesn't increase the risk of plaque formation in our blood vessels. And over the years, the researchers have found that a combination of the saturated and polyunsaturated is needed for optimal health.
Okay. Give us an item from the food aisle which would have that polyunsaturated fat in it, and give us an item or two which would have the other fat in it. So
on food labels, this brings up an important point. You need to read food labels when you're shopping. On many processed foods will have on their back something called trans fat or partially hydrogenated fat. And those are two types of fat that actually are horrible for our systems. The body can't digest them, and the fat goes directly to our fat stores, and we have them for life. We can't ever break them down. So you asked about examples of the good types of fats. Saturated fat would be like regular butter, avocados, almonds, and like things that would have trans fat would be like donuts and cookies and pizza and Twinkies, and you're going to see the trans and polyhydrogenated products that are processed.
Okay. Now, tell me a little bit. You mentioned the word butter, and personally, I try to buy raw butter, basically uncooked butter. We try to buy raw milk. Frankly, it's not always very easy. Butter is all right. You seem to be still getting it somehow. But milk, you have to go through a hula hoop. In Whole Foods store, even stopped selling. Well, actually, they still sell the raw milk, I think. They stopped selling the cholesterol milk or so. Anyway, it's not that easy to get it. In fact, we are still lucky in California where we get it more than in other states, apparently. Is there something to it that, you eat raw butter versus the normal butter, which is cooked and pasteurized? Same thing, I guess. But never mind, of course, the margarine stuff. That's when you say butter, that's not butter, right?
Right, yeah. Right. Margarine is manipulated and so that it lasts longer, and it's not healthy. Even the margarines that are supposedly out there to help with blood pressure problems and cholesterol problems, it's much better to eat regular butter.
Okay. And then is there something to it, to like having that stuff raw rather than pasteurized? What's your take on that? Because obviously the government tells us we've got to have it pasteurized, otherwise there are too many germs in it. And someone like me, I believe, people didn't die from germs; they never did. But you're killing all the good stuff by cooking, which is what pasteurizing is. So give me your take on it.
Right. I feel strongly that either raw is definitely better, but it's hard to get it, and it's more expensive. So organic would be your next best bet to ensure that it's a good quality.
Okay. All right. See, so raw would be organic. Raw would be the best. Organic pasteurized is the second best, and then just normal is the other one. And the fourth one would be taking the substitutes such as margarines and whatever they're called.
Correct.
Got it. Thank you very much.